Good afternoon, everyone. Good afternoon, colleagues, comrades, and contributors, hopefully today. I'm delighted to welcome so many of you to our webinar today on data linkage, what it is and what it can tell us about children's lives and experiences. So I'm Mickey Anderson, data lead at Celsus, and I'll be chairing today's event. Around the time I started at Celsus, the Scottish Government published the Looked After Children Data Strategy way back in November 2015. And there were high hopes and great expectations that linkage to numerous data sets, as they put it, would improve understanding of outcomes for looked after children. And I think it's fair to say it's been a more difficult and perhaps a longer journey than originally anticipated. But there has been substantial progress in this and other areas of linkage in terms of administrative data sets. So personally, I'm really delighted to be here and really looking forward to hearing about that today. So let's move on to our presenters today. First of all, we're going to hear from Dr. Joanna Sorohan. Joanna's work focuses on the use of population-wide administrative data to derive insights into the lives of children and young people who are in need of support from services, with a view to driving improvement of these services. Joanna will talk us through what data linkage is, explore its benefits and challenges, and provide insights into data linkage through examples and existing research projects. I'm also delighted that we have a Scottish Government colleague joining us today, and that's Craig Kellogg from the Children and Families Data Analysis Unit. Craig's been a statistician at Scottish Government for some time, worked in a number of different statistical teams, and he's been leading the Children and Family Statistics team for the last 4 years. It feels like longer, Craig, I think. Craig is responsible for development and production of the children's social work stats and related analysis of that. So Craig will tell us a bit about the benefits and challenges in linking Scotland's children's social work data sets and how this information is currently being progressed, I think that is. Our final contributor today is Sian Robson, Senior Data Analyst at Research Data Scotland. Sian has an interesting background in neuroimaging research into psychiatric disorders. She's worked as an analyst at Healthcare Improvement Scotland and as a policy advisor in the Scottish Government's Child Protection Unit. She started her role as a senior analyst at Research Data Scotland in September this year and is working on the Administrative Data Research Scotland programme. So Sian today will provide us with an insight into the Looked After Children Data Linkage Improvement Project and provide an overview of the efforts currently in progress to overcome challenges with that. So we're going to move on now to Joanna, who's going to take us through our first input today. So Joanna, over to you.
Thank you, Mickey. I was going to introduce myself, but no longer need to, so thank you for that. So I can just jump straight in. Hopefully those slides should be coming up now for you. Let me know if there's any issues. So as Mickey said, I'm just going to cover a bit at a very high level about what data linkage is, what we mean by that, and how it can be done in practice. I've got a few examples of existing work that's been done with linkage projects in Scotland and what kind of insights that's been able to give us. And I'm just going to go over briefly the benefits and challenges of this type of approach to research as well. So what is data linkage? So data linkage refers to the process where we can combine data from different sources or collected by different bodies that relate to the same person or entity. And at a broad level, that's done by matching records within different databases based on common identifiers or identifying information that is stored within those data sets. So data linkage can be done kind of in a variety of settings and by different organisations. It is done by public bodies, and an example of that would be through the analysis of linked information that's brought together from different governmental departments. And that would be done with a view to better understanding the services they're delivering and those that are engaging with them. But data linkage is increasingly being done by researchers in addition within academic environments, and they're able to access public data for research where they can demonstrate that will provide some societal benefit. So I would personally fall into that latter category, and that's what a lot of the focus for today's content will be more on the research side of things, but hopefully a lot of the kind of learning and material covered will be useful for those of you who are working within local authorities or other public bodies and are wanting to see how you could use your data more effectively as well. So as I say, data linkage is a process of combining data from different sources but that relate to the same person or entity. And the type of data that I mean when I say that is regularly known as either administrative data or routine data. And it's the data that's collected as we just go about our daily lives and interact with different public bodies. So looking at the women in orange on the left here, we can see various different examples of when in an individual's life course that type of information might be collected. So right from when we're born and a birth record is created for us within the NHS systems, all these other interactions such as sitting an exam at school, attending court, registering with a dentist, information is collected on all of those interactions and held by the various bodies that we're interacting with. So as you can imagine, for that one individual over the life course, that's a huge amount of information that's gathered on each of us. And then when we then scale that up to a population level, it's just a huge resource and amount of information that is available out there. So considering just one of these data sets on their own, for example, the data on school exams, that's a really rich resource in itself and contains a great deal of information and insight for us around how children are attaining at school and other things. But when we can then go on to link that data set to other sources, that's where we can really kind of unlock its potential and get a much better understanding of how the kind of different aspects of people's lives are interacting and the intersectionality of these different aspects. For example, by combining different data sets here, we could start to think about other more nuanced research questions. So not just how are children performing at school, but things such as, do children with long-term health conditions achieve fewer qualifications at school? And if so, what supports can we put in place to mitigate that? We could also think about what are the physical and mental health challenges faced by young mothers, or things such as are young children who have poor attendance levels at school, do they go on to have higher risk of criminalisation as young adults and beyond? So by bringing these sources together, that's when we can really kind of unlock the value within them and provide a lot of insight that wouldn't be possible through just looking at one individual data source. So in terms of the practicality of how it's done, as I said, this is done by matching records based on common identifying information that's stored within multiple data sets. So if we look at the graphic here, we have database A, which we could imagine as an education data set, and database B, which could be a particular health data set. So if we want to kind of recognise which records relate to the same individuals across those, we could choose a certain number of variables that exist in both data sets, and that could, for example, be the name, date of birth and address of an individual. So if we're looking at this example here, these two records have been pulled out that relate to Robin and Rob Jefferson. By looking at that with the human eye, we can determine that that's very likely that is the same individual. It's a variation on the same name with the same date of birth and address, albeit stored in different formats. However, when we start to talk about data at the scale that I mentioned before, at the population level, that kind of look and see approach isn't going to work, and we need something more systematic. So we need to do this in a kind of computational and algorithmic way. So the linkage can be done in a couple of ways, one of which would be deterministic linkage. And that is where we can impose a rule that the variables have to match exactly across both data sets. So that will obviously give us a really high degree of confidence that anyone we're detecting as a match in the two data sets is indeed a match. But as you can see from the example above, there would be a lot of instances when a match that we would deem to be a real match with human eye would actually not be detected. And that can be due to things such as differences in recordings of names, nicknames, and also just differences in recording formats for date of birth and address, as well as things just as simple typographical errors. So in practice, that approach isn't very practical in general for linking administrative data sets, and more often than not, we need to go to a more complex approach, which is known as probabilistic linkage. So for probabilistic linkage, we're then moving to using kind of statistical techniques to look at it in a more complex way where we can allow for errors and differences between the variables, but assess the degree of similarity and what our confidence can be that those are true matches. And in terms of doing that probabilistic matching, it's extremely beneficial where we can have unique identifiers such as the NHS CHI number or the Scottish candidate number contained within a data set. And that's for a couple of reasons that that's really beneficial. So one is that it's less susceptible to those kind of differences in format recording errors that you would often see for date of birth and address. But a really key thing is that it's a unique identifier. We can imagine if we're thinking across Scotland as a whole, there may be multiple Rob Jeffersons out there, and there will most certainly be multiple people who were born on that date of birth, and there's very often more than one individual that lives at an address. So none of those are actually unique to an individual, whereas identifiers such as the CHI number from the NHS and the Scottish candidate number given to children at school are unique to that individual. And so where those are present and available in a data set, that can really increase the accuracy and efficiency of linkage. And so we make a really strong case for gathering that type of unique identifier within public data sets where possible. In the case of a research project, that linkage process that I've just described, that would generally be carried out by the researcher themselves. This would normally be done by a trusted third party, which within Scotland is normally the National Records of Scotland. And how the process works is that the National Records will pass those linkage variables from both data sets, which in the last example would be the name, date of birth and address. And that's the only information that they would get from each data set. They can then use that to run their linkage algorithms and determine which records relate to the same individuals and provide a unique identifier to each individual. Those identifiers are then placed back in the original data set, but with all identifying information removed, so the name, date of birth and address taken out, and that is what then comes to the researcher. And what that means is that no individual at any one time sees all of that information together. We're not seeing an individual's personal identifying information alongside any information about, say, that is their education or their health or whatever the data sets may be. And that's just one of kind of many steps and safeguards that are in place to try and protect people's privacy when working with admin data and data linkage. There's a framework known as the 5 safes that is in place to try and protect people's privacy, and the 5 safes refer to safe data, safe settings, safe people, safe projects, and safe outputs. So safe data would be that piece that I've just discussed, where no one sees everyone's information at once, and the data is de-identified and linked by a third party. Safe settings refers to the fact that the data is stored securely in what is known as a trusted research environment. And within that environment, there are very stringent kind of security protocols in place, certain people that can access that, and nothing can be uploaded or downloaded directly by researchers. The researchers that access that need to go through strict approval processes and also undergo training to make sure that they are up to date with how to safely handle this kind of data and aware of all the kind of privacy and legal implications. They can also only access data when they're working on a specific project that has gone through, again, stringent approval processes, such as public benefit and privacy panels. And these processes will determine whether the societal benefit that can come from this research outweighs any privacy risks, and that adequate measures have been put in place to protect privacy. And finally, safe outputs refers to the fact that, as I mentioned, nothing can be downloaded directly from this research environment where the data is stored. So any results that come out of that do go through checks by a third party again, just to make sure that nothing is coming out that can be identifying for any individuals. So rightly so, there's a lot of work done to kind of safeguard and protect people's privacy throughout this process. So we now have a look at some examples of existing work that has been done using linked data on children and young people in Scotland. So the first example, some of you may well be aware of, is the Children's Health and Care in Scotland study, or the CHIC study, and this was carried out by Murray Mallock and colleagues at Glasgow University. So through this study, the researchers had access to children's health data at a population-wide level, and also access to the data on looked after children in Scotland. And through linking those two sources, they were able to identify 2 cohorts of children, one cohort who had experience of care within their childhood and another cohort who had not. And by having access to that kind of population-wide data, they were able to do some quite in-depth analysis to get a much better understanding than we already had of children and young people's health for the care experienced population. So their findings included things that, unsurprisingly, children who had experience of care were more likely to face adverse health events. And that was even after accounting for the fact that they were more likely to come from more deprived areas where we'd expect to see a higher prevalence of health concerns. Having data that kind of spanned multiple years and the course of the childhood meant that they were able to look at different time periods as well. And one key finding was that they saw a really sharp increase in health problems at the point where young people were leaving care between the ages of 16 to 18. So really highlighting the need for kind of ongoing support for those young people as they transition to independent life in order to maintain their health. Another interesting finding was around the prevalence of type 1 diabetes and asthma, which they actually found to be similar across the 2 populations. However, those with care experience were actually far more likely to be hospitalised from those conditions than those who did not have care experience. So that kind of identifies a need for support for children and young people in care around maintaining and managing their symptoms as well. So really providing a lot of rich, detailed evidence on children, the health of children and young people in care. Second study is one that's published quite recently, and this was worked on by myself and colleagues at Celsus and Scadder. And this was a study focused on children who are growing up in kinship care in Scotland. By kinship care, I mean children who have come into care, but rather than living in foster, residential or other types of care settings, they live with members of their extended family or friends. And this has become increasingly common within Scotland in the last 15 or so years, and in the last 2 or 3 years has actually been the most common environment for children in care to live. And so with that in mind, we wanted to gain a better understanding of the experiences of these children and those who support them. So to do so, we had information from the children's social care data sets, and this was linked to information from children's experiences from education, early childhood development, information from health visiting programme, child protection, and also information on interactions with the children's hearing system. So it's a really broad range of data that we had access to, and we were able to get a lot more nuance about our understanding of the lives of children who are in kinship care in Scotland. And this included things such as the fact that we could see that over that time period from 2008 to 2019, there had been quite significant improvements in the education outcomes for children who are living in kinship care, which was really positive to see. However, unfortunately, at the end of the study period in 2019, there was still quite a significant gap there, and that was in terms of attainment, likelihood of exclusions, and various other educational outcomes. So really highlighting the need there for additional supports around education for kinship families within Scotland. We could also look through our linkage to the Child Protection Register. We could see that for children who are in kinship care and had been placed on the Child Protection Register, that parental substance misuse was the most common concern for that. So again, just a greater awareness of the challenges that are faced by families who have children in kinship care. As I mentioned earlier, that this type of research isn't only done by researchers in academic institutions, and public bodies do utilise data linkage as a tool internally as well to help them understand the services and those that they're there to support. So one example of this would be Scottish Government's Education Outcomes for Looked After Children publication. So this is an annual publication that links education data with social care data in order to provide an understanding of the education experiences of children in care. There is a variable collected within education data, which is an indicator for whether or not a child is looked after. So in theory, this work should be able to be done to some extent without data linkage. However, that variable within education isn't always accurately recorded. From the Grown Up in Kinship Care study, we estimated that around a third of the children in our data set who had been in care didn't have that recorded in their education records. And in addition, where that is recorded, it's a binary marker saying that a child either is or isn't in care. But by linking the education data to the social care data, what the Scottish Government are able to do is to look at the education experiences of children in care in a lot more detail. I mean, they can take into account things such as does the environment that a child lives in care, be that kind of at home with their parents, in residential care, in foster care, does that impact upon their education outcomes? And do things such as the stage of life in which they've come into care, does that impact on their education? So it gives a lot more detailed understanding both for the government and for other stakeholders about how education and social care are interacting. Obviously, today's focus is on how we can better understand children and young people's lives, but I think it's important just to highlight that there's a lot of work going on with administrative data far beyond that scope as well, and it's a really growing area. So there's a few examples here of other research that's been carried out in Scotland in recent years. And you can see how broad the kind of areas of interest are, from things such as looking at admin data to classify the motivation of online drug purchasers, through to how the way in which we travel to work can affect our mental health. We expect to see it to be a continuing an area of research that continues to grow. So what are the benefits and challenges of linked data research? So for me, a key benefit of admin data research is that it can offer a population-wide picture. And as I say, the data sets that we're talking about are collected at scale, and anyone that's interacting with public services will have this information collected on them. So that's just at a scale that we could never dream of achieving with other approaches, such as kind of interviews or surveys. And that can be really helpful when trying to look at firstly, we're more likely to capture populations that would be less likely to engage with other types of research methods, particularly there might be some demographics that we'd be less likely to see in these other types of research that will be included in these data sets. Another benefit is this data has already been collected. As we go about our lives, as I say, this information is always collected on us anyway, and it's a resource that is sitting there. And so by doing this type of research, we're really maximising value from existing resources, as opposed to kind of putting money, public or otherwise, into kind of collecting information that already exists. Another benefit is that there's not a burden on participants. It's not something that they actively need to engage in or go out and take part in surveys. So it's quite a easy and effective way of gathering this information. And given the fact that it's collected kind of over time as we go about our lives, it means that we do have extended follow-up periods. And this is really useful because it allows us to start thinking about things with a longer lens. So we can think about, well, does experience of care as a child, how does that impact upon, say, health outcomes as an adult or employability prospects as an adult? So we can really take a long-term view of things, and also have a look and see things such as how does a certain policy that's been implemented or a change in practice have a change in outcomes over time. And as I mentioned earlier, while each data set on its own is a really rich resource, I think as we start to kind of bring multiple data sets together and have a look with that kind of wider lens about how different aspects of lives interact, we can get a much richer understanding of society and how better we can support people within that. Also, as with everything that has benefits, there are many challenges with admin data research as well. So kind of a key one of these would be that this data isn't recorded for research purposes. As I say, it's recorded kind of operationally as services go about their business and interact with people. And as such, it can often contain errors and inconsistencies. And alongside that, there are also changes to recording practices over time. And this can be due to things such as changes in policy or practice, but also just broader, more cultural changes in terms of the way things are referred to. When we're looking at data over a long periods of time, there can be quite a lot of work done to kind of harmonise that and ensure that things make sense before we can start our analysis. So as I mentioned earlier, there are quite a lot of processes and steps to be taken in order to get approvals for these types of projects. And as such, it can be quite a lengthy process to get access to these types of data sets. And along with that, there are costs involved to cover kind of the resources needed to go through those processes. A key challenge for me of admin data is also that at times it can provide us with more questions than answers. And that's because this data is very good for telling us what is happening, but there's not often kind of nuanced and experiential information recorded within it that can tell us the why. So if we think at kind of a broad macro level, we can see from the administrative data that the number of children who are in care in Scotland has been decreasing quite substantially in the last few years. But what we can't necessarily tell or what isn't recorded is why that's happening. So we can theorise around that and see potentially this is the implications of the promise and the kind of practice and cultural shifts that are going on around that. We can wonder if this is an artefact of the decrease we saw during COVID and if it's an ongoing impact of that. But we don't always have kind of information contained within these data sets to know why we're seeing what we're seeing within them. And so as such, I think that there's a really great deal of value can be added to this type of research when we do some complementary work that involves actually talking to people, be that practitioners or children, young people and families whose lives we're seeking to understand. So the previous challenges relate to whether we're working with one data set or multiple, but when we do go to working with kind of multiple linked administrative data sets, there are some additional challenges that come alongside that. So with each data set that we want to link, it will have what's known as a linkage rate. And that rate just reflects the proportion of people within that data set who have sufficient identifying information of a good enough quality to allow them to be linked to other data sources. So where that linkage rate isn't very high, that can affect our findings, and in particularly so if we have certain groups who potentially don't have as good quality linkage information or have more missing information, that can therefore mean that their experiences aren't represented in our findings, which can introduce bias. So it's really important that that's explored when carrying out one of these types of studies and that that's reported with full transparency. And unsurprisingly, if we're wanting to access multiple data sets instead of one data set, there are kind of more rigorous approvals to go through and also longer timeframes for access given the additional work that's required to carry out that linkage. And both of these challenges were presented themselves within the Growing Up in Kinship Care study, which I mentioned earlier. So in terms of the linkage rates for data sets, at present, the data that we used to look after children and the child protection data sets only had linkage rates of 68% and 42% respectively. So a lot of children who weren't able to link to those additional sources. I won't go into the detail of why that is at the moment, as Craig Kellett from the Scottish Government will discuss that in a little minute. But yeah, it's definitely an area where it'd be great to see some improvements so that we can get kind of higher quality work in this area in Scotland in future. In terms of long time frames for data access, for that particular project, the process from initial application through to data access was around 3 years, so quite a lengthy process there. However, that said, there are reasons for hope. So at the moment, there are that kind of lengthy process I spoke about. There are a lot of organisations that are working to kind of try and improve that, many of which you can see on the slide here. And not only is there work going on to improve the access processes to data, but also to improve the kind of quality of the data that is available when you can access it. And I think that is largely due to the fact that there is a growing understanding of the value of this type of data and the opportunities that can be provided through data linkage research, and of the need to have kind of robust, good quality data that underpins that. And this has also been recognised by the Promise Scotland. So in Plan 24 to 30, they have a vision by 2030, incomplete data will no longer be a barrier to data linkage or use. Data will be joined up, allowing people and organisations to see entire journeys and changes over time. So just to summarise before I pass you on to Craig, I think key takeaways would be that data linkage is a tool that can really provide great opportunities for us to better understand society and in particular the lives of children and young people within that. There are still many challenges faced in doing this type of research and this type of work, but there's a lot going on to try and improve that, and it's great to see that, and hopefully that will continue in the coming years. And as a final takeaway for, I think many of you are joining us from public bodies today, I think it's really important that the public data that is collected by these organisations is robust and in the kind of name of transparency and accountability and also improvement, that's made available for research in the public interest. And a key thing would be that could improve things rapidly would be the recording of unique identifiers such as the Scottish candidate number and CAI number in these data sets. So that is me, and I will now stop sharing and pass you over to Craig.
So yeah, thanks, and thanks, Mickey, for the introduction as well, and for the invitation to speak here today. Definitely good to see so many people interested in data linkage. So I'm here primarily to introduce the current process for linking children's social work data, and I'm going to focus mostly on the challenges with it before handing over to Shan, and then we'll move on to Q&A. So a bit of background first. So the data returns included in children's social work statistics managed by my team cover children in care, so that's looked after children data, sometimes known as the CLASS data, so children looked after in Scotland data, as well as care leavers and child protection. And those data collections run annually, so my team collects and quality assures data from each local authority, then produces statistics using that data. So those data collections were individualised, so around 15, 16 years ago, a bit later in the case of child protection. So that means, so we've got data about individual children, so each placement of care, each child protection investigation, etc. within that, and that's had a lot of benefits. So firstly, improving the quality of data, so enabling statisticians in my team to rigorously quality assure data that underpins the stats, enabling more granular analysis, so published stats and any other analysis can go beyond high-level summaries or year-end snapshots, that sort of thing. But also opened up the potential for linkage, which is what we're talking about just now. And that's included those routinely published statistics by my team. So Joanna put them on one of our slides. So that's where we link social work and education data. And then also the really valuable work which happens when researchers outside government access the data, often linked to other administrative or other data, to do their own analysis, which then helps develop an understanding relevant to policy development or evaluation. So just thinking about the history of the CLASS data, how it's developed, how it came into its current form, I think there was clearly a big focus at the time on linking to education data, and for good and understandable reason. And that's what's enabled the production of those statistics that we've both mentioned. And that was achieved by adding the Scottish candidate number to those individual data returns. So clearly that enables linkage to other individual data returns which have the Scottish candidate number on them. So schools, data, attendance, exclusions, attainment, school leavers, destinations, etc. And where it's possible to link to education data, it's then possible to match to the NRS population spine because of the identifiers available on the education data. And I think Shan has a slide which will show the current process which enables that matching. But it's through the Scottish candidate number. So there's some limitations to that, and those mean that we should look again at the process that we have in place, and that's what we'll go on to talk about. The main limitation comes down to the fact that the candidate number is only available when a child reaches school, obviously. So even though if you look at our published statistics, so that the education statistics for looked after children got pretty good matching rates to education data, so we typically report over 90% of children matched between the social work and education data, 92, 93% typically. We don't have any SENs for children in care who've not started school, or children who've been in and out of the care system before ever going to school. So if you look at the latest overall data, so if we compile together the 15, 16 years worth of individual data that we've been collecting over that whole time, and we do this to develop our analysis of children's care journeys or care experience, as Joanna showed in the slide, we're missing candidate numbers and therefore the ability to link that data for something like 30% of children. And where we do have a candidate number, there's a small number where we're still unable to match to the population spine for some reasons. So, but the main reason that's leading to that is the age of the children, obviously. So there are small numbers of children for whom we never receive an SEN in the social work data, and there's various reasons for that. And a very small number who seem to have multiple SENs over time, and an even smaller number where we didn't actually get an SEN which could be matched to education data. But largely, the limitation to linkage is driven by the fact that it's not possible to get a candidate number or a child's too young to have one. So that's where there's work now to look at an improved process for linking the data. We'll hear about that in a minute or two. I'll not say much more except that when we're developing that work, and there's multiple approaches that we could take to it really. There's challenges that we need to work within. I've mentioned on the slide data protection and information governance generally. So it's likely that any solution to those sorts of challenges is going to involve data sharing or processing of identifiable or identifying bits of data. So that needs to be robust and satisfy the Information Commissioner's Office guidance and clear position, which is that there's certainly no reason that my team, for example, needs to be sitting on identifiable data. I don't need to know who's in the data. We need the individual data to do the analysis and to enable the linkage. And there's also a retrospective angle to think about. So we could put in place a solution to those sorts of challenges now that takes effect now and into the future, but we've got 15, 16 years worth of data to think about as well. So we should bear that in mind as well when thinking what the potential solution to that is. I'll hand over to Shan now. I've got a slide that says questions, but we'll take those at the end and I'll just stop sharing.
Should be coming up now. So yeah, lovely to be here. Thanks very much for the opportunity to speak on behalf of Research Data Scotland. And yeah, I see some familiar names in the list there from my previous job as well. So yeah, it's nice to be back in this this kind of context. So my talk today is just going to be split into two sections. First of all, I'll talk a bit about Research Data Scotland as an organisation, what we do, and then I will go into talk about how we're getting involved in this Looked After Children Linkage Improvement project. So in terms of Research Data Scotland, we are a charity that was set up in 2021 by the Scottish Government, and we are making it faster and simpler to access Scotland's public sector data for research purposes. So the aim of that being for the research to then inform evidence-based decisions, about policy and practice, to ultimately obviously try to improve lives for people in Scotland. So basically Research Data Scotland are trying to build on and transform key aspects of the data systems that exist in Scotland at the moment. We clearly can't do that on our own, so we're working in partnership with various different organisations across different sectors, so obviously public sector bodies, government, third sector, academia, and so on. So very much a partnership organisation. Our focus for this year is under 4 key themes, and there's many work streams within each of those. I couldn't possibly go into everything that Research Data Scotland is up to at the moment, but I'll just pick out 1 or 2 things under each theme just to give you a bit of a taste. So in terms of aligning approaches, an example of that is we've been working with the regional and national safe havens on a federated approach, so establishing essentially common standards for access to and use of data across the different safe havens. In terms of trustworthiness, we have a great public engagement team that do work including co-hosting the Scotland Talks Data Public Panel, which is a group of public members of the public who are invited to meet and discuss and give feedback on proposals about research projects. Under that second theme there, I'd like to highlight our Researcher Access Service. So this was launched in April 2024, so just earlier this year. And it's an end-to-end digital pathway for researchers to track their requests to access data, and it includes a sort of simpler approval process to the sort of existing processes in place through the public benefit and privacy panels, which some of you may be aware of. The sustainable system is really just about us kind of diversifying the funding sources that come into RDS, so things like applying for research grants and having users our services pay for those services. But the theme that's definitely most relevant today is this one about unlocking Scotland's data. So ResearchGate Scotland doesn't collect any data. We are really just trying to help researchers make the most of data that already exists. But as we've heard, that's often in lots of different organisations. It's not always easy to access and not always easy to link data from different places. So, and often actually as well, the sort of current process for linkage can be on a create and destroy kind of model, whereby a project that links data from a couple of different sources has an agreement with the data controllers to do that linkage, and the agreement is with the project or the researchers delivering that project. And once the project is finished, the linked data is then deleted. And then if someone else comes along and wants to link similar data sets, the whole process starts again. So obviously it's not a particularly sustainable process to carry on that way. So ResearchData Scotland are trying to identify, to start with, some of the most frequently requested data sets or topical ones, and we're helping to make them available in a secure format, so under the 5 Safes framework that Joanna was referring to, but in a format that's available for reuse purposes across multiple different projects. And we are doing that in collaboration with Administrative Data Research Scotland, which is itself a collaboration between the Scottish Government and the Scottish Centre for Administrative Data Research. So my organisation, RDS, have been commissioned by the government to take on some of the tasks underneath that programme, and that includes ingesting some of the Education Analytical Services datasets into the National Safe Haven in that sort of linkage-ready format, basically, where it's in a secure format. And there are a few datasets for which that has already been done. Those are listed there, and you'll see Looked After Children is one of those datasets, and there are more in the pipeline as well. Okay, so that's a bit about a whistle-stop tour of ResearchData Scotland. So now coming on to what we can potentially do to help improve the situation with the sort of difficulty in linking some of the Looked After Children data. I should say this is very, very, as Craig mentioned, very, very early days in this project. It was really just given approval in principle from the ADR Scotland senior management team in September earlier this year, just to progress ideas about a proposed improved process. So we are, open to ideas and thoughts today, very much looking for your input, if possible, on your thoughts on this proposed process that I'm going to show. So I will, I'm going to put a couple of flow diagrams here, one of the current process and one of the proposed process. But just to give the disclaimer, these are both very much simplified versions of what actually happens, but hopefully will give enough of a sense of the current situation and the proposed change. So as we've heard, local authorities at the moment send Looked After Children return to the Scottish Government on an annual basis, but crucially that does not involve or does not include the names of those children. Excuse me. Scottish Government then work with National Records of Scotland indexing team. So as we've heard, that is the trusted third party for de-identifying and linking data in Scotland. So Scottish Government can send the identifiers available, which includes Scottish candidate number for some of the Looked After Children, but as we've heard, not all, obviously, if they don't have Scottish candidate number. NRS do the matching to the spine, so that's the indexing process essentially, where they match the identifiers from the data set that they're given, just the identifiers, match that to the spine, and return to the government a key so that they can add in a unique identifier for that data set and return a key so that Scottish Government can identify who in the original data set is matched with a new identifier. So that new identifier makes the data pseudonymized, and those are the data that then go on to the Edinburgh Parallel Computing Centre for ingest into the National Safe Haven. And so EPCC never see any of the Looked After Children, never see any of the identifiers. NRS never see any of the Looked After Children data, they only see the identifiers. So there's that kind of split in the process that keeps identifiable data secure. And that is the current linkage process for many different data sets. I'm just showing it for Looked After Children here. And it works on the whole pretty well, but not if NRS don't have enough information about the individuals to match them to the spine. So if they don't have name the individuals, or a unique identifier like Scottish candidate number, it's just really not possible to match them to the spine, and therefore they just can't be linked to other data sets like health, for example, as we've heard about. Okay, so proposed change in the process. This first bit is the same. The local authority sends their looked after children return to the Scottish Government. Separately, we suggest that they also send personally identifiable information, including names, to the National Records of Scotland indexing team, which will enable them to massively improve the match rate to the spine. And from then on, it's a similar process, basically, which will result in a data set which will be more able to be individuals, and they will be able to be linked to other data sets. Those with an eagle eye will notice a slight difference between the anonymisation, but that's a sort of technical process about the kind of linkage and anonymisation that is probably going to happen over the next little while. So I've just popped it in the diagram there, but I don't want to go into too much detail about that today. So just to highlight the bit in the star there is a data processing agreement. So that is a new thing that would need to be put in place between the local authority and NRS in order to share that personally identifiable information. Okay, so those are the processes, the proposed improvement, and this is just the benefits that the improvement would potentially bring. Obviously, improved match rate to the spine, which allows linkage to other data sets, and then that allows a better understanding, essentially, of factors influencing the looked after children's lives. That could then, research based on that, could inform evidence-based decision making for policy and practice, and hopefully outcomes for children. Just to reassure you about the legal basis for that data processing, so that transfer of data from looked after from local authorities, to National Records of Scotland. The lawful basis for that, the legal framework for that, is exactly the same as what is currently in place between the local authority and the Scottish Government in terms of transferring the looked after children data. So it's the same legal basis in the public interest, basically, that framework could be in place. And National Records of Scotland have a standard data processing agreement that we would be looking to support through Research Data Scotland's information governance staff. We'd be looking to support putting in place those agreements between the 32 local authorities and NRS. So yeah, when we get to the question and answer session, would be happy to receive any thoughts on what people think about this proposed change in the process. Transfer of personally identifiable information to NRS to improve matching to the spine. If you would like to put any comments on that in the chat as well, that's good too. Yeah, and then there's just a wee QR code there if you want to hear a wee bit more about Research Data Scotland. You can sign up to our newsletter. So I'll stop sharing. Back over to Mickey.
Thanks, Sian, and thanks to Craig and Joanna as well for their contributions there. Quite a lot to consider within that, and certainly some information that's new to me within it. So as Sian said, Sian has actually asked you all a question there, so it would be great if you could actually put something in the chat in response to that, just about what you think about that proposed new method for linking data and the extra, I suppose the extra burden, and to some degree that puts on local authorities out there. So we're going to jump on to questions and answers now. So feel free to add questions as we go in the question and answer function there. But we'll start with a question that a few people have upvoted, and probably Craig to start with, maybe with this one. Are there any plans in place to adopt a cross-sector identifier, which would cover health, social care, education, for example? And I think I'm aware, Craig, I don't know if I might be right on this, that there are moves in that direction in England.
I think that's right. And there's certainly been discussion and consideration at various points. I suppose I don't want to set an expectation that that's happening when the process that Sian's outlined is really our proposal for how we advance this, though, which is a bit different, but it should achieve the same sort of result.
Okay, Thanks, Craig, for that. So with another question about the extent of co-production between services and academia in terms of getting together and looking at data linkage priorities with the view to system improvement. Anybody aware of any kind of examples around that or that sort of agenda?
Yeah, I think it's a really good point, and it's something that's very kind of crucial because we, as researchers, we want our research to have impact and to make a difference. And if we're looking at things that actually aren't of interest to services, then they're not going to be able to influence things. So I think it's a really key thing. It's something that we do try to do within our research at CELSIS, where we can. We're quite lucky kind of that we have a lot of quite strong networks within the sector, and we will try to involve other various services within our kind of research projects in different ways, whether that's kind of membership of an advisory board or discussions prior to that, and certainly kind of in terms of disseminating our findings and engaging with organisations to try and get impact. But so I do think it's very important. I think I know certainly the DWP, the Department for Work and Pensions, they will publish a list of research priorities on their website, and I think that's something that'd be really good to see from different kind of departments or different services as well, the things that they want to look at. I think that would really help to make sure that the research is looking at the right things as well. Really, really important.
Thanks, Joanna. We have another question here asking, are we aware of any examples of linkage projects done at the local authority level or national research that can be broken down to local authority level?
I'm not, Craig or others may have knowledge of that. I'm not personally within Scotland. I know there's quite a lot of work going on in England at the moment around trying to get a sort of single digital view of the child. So within different local authorities, they have different approaches to doing this, but trying to bring together information from, say, education, health, police around, and that can be accessed in one portal kind of thing for services to be able to kind of deliver it more effectively. It does seem to be more advanced in England than in Scotland at the moment, from my understanding. But if anyone does know of other work in Scotland, do jump in. I think also there are complications around that, as with anything with data, around the practicalities and the legalities of it. But I think it's definitely there's a lot of interest in that direction at the moment, I think.
Yeah, I'm not aware of I can't think off the top of my head any examples. I thought I had one, but it wasn't actually a linkage project, but it was data access for one particular local authority area. So no, sorry, nothing to add to Joanna's answer that.
Okay. And I think Joanna, an example shared with us quite recently was Somerset Council, where they're doing linkage, but it's within the local authority, so it's data sets within that local authority, it looks like. But there are complications within that too, because sharing information across services within the local authority has its own challenges. But I think practice in England certainly seems to be a wee bit further ahead in that area. An interesting question here. I'll move on to some others in a second, but maybe Shan, you might have some idea on this one. What's the minimum linkage rate for a data set to be viable?
Yeah, I spotted that question, and I did want. Well, there's obviously not an exact cutoff. I suppose it will depend on the data, but yeah, no, it's true that it depends what you're wanting to get out of it. But there's not an exact. But you will get from National Records of Scotland will send you an indexing report to show how effective the matching has been. You would potentially end up. You might need to look into detail essentially who has not been able to be matched, because you might end up like in the case that in the Growing Up in Kinship Care study, where there's a certain group of people that haven't been able to be matched, and that is the children under school age. And so then you're introducing a bias in your analysis essentially. So yeah, the match rate in itself is not a sort of, you can't progress if X number of people can't be linked to the spine. It depends how big your data set is to start with and the kind of statistical power and that sort of thing, but you have to be careful about who's not then been able to be linked, and if that is a certain group or a certain characteristic, then you have to be very aware of that in any of your analysis.
And have you ever come across an example where that would prevent research continuing?
I'll say it's very early days for me in the research data Scotland world. I've only been here a couple of months, so I can't think of one off the top of my head,
Okay.
but it may
No
happen.
problem, Sharon. Thanks for that. A question possibly for Craig or Sharon, actually. Is there a reason government publishes data linkage work on educational outcomes for looked after children, but not other groups of children? So, for example, outcomes for those who come into conflict with the law or the children's hearing system, for example. Probably you, Craig, I think.
That's probably me, given that I published those statistics. So I don't know if I've got a satisfactory answer to that. It's, and I wouldn't say it's like an active decision to not publish those wider stats. I'd say we are looking at what should be within scope of those statistics in particular, with a view to potentially broadening out. But I can't really say specifically what that will entail. We'll be doing a bit of user engagement work on it and thinking about relevance to the current policy landscape and the promise when we're doing that. So that's probably all I can say about it at the moment.
Thanks, Craig. So I'm just keeping track of some of the questions coming in. Quite an interesting one has come up about use of just find it again. Use of KI numbers. Use of SCNs, first of all, about whether that's allowable from a GDPR perspective, and actually even more so for KI numbers, this person has said. So some LAs keep that data separate, then spend time manually linking SCNs with CMIS returns, etc. So what's the position around that and the legality of using KI and SCN and other data sets?
Yeah, I'll try this one as well. And that's probably a conversation between the local authority and the ICO, I would say, or your legal and data protection teams. And certainly, so the equivalent conversation, I suppose, has happened with Scottish Government and ICO in terms of how we hold and handle data with identifiers, the SCN in particular. So I think that conversation probably needs to happen. In our case, that was quite constructive, and I think this information has been shared with local authorities. But just to repeat that, is that the Scottish candidate number at this point will continue to be included in the social work and other education data collections as the data collections are underway and quality assurance work's going on. But it will be pseudonymized at the point at which that data collection is finished, so we don't need to be sitting on it any longer than we need it to undertake data collection. So there's maybe a similar position that holding the data at a different point, but there's maybe a similar sort of consideration for the local authority itself.
And there's a bit of a plea come in from somebody in local authority land as well, about people there being very worried about breaching data protection, and if there's any guidance around that.
I've not seen that question, but I think it's probably the same answer. I mean, the guidance would come from ICO and legal colleagues.
Okay, so another question that came in recently, would it be possible to link data from the parent carer and the child? For example, the parent's data on health, housing, postcode, etc., and the child's outcome data? Is that cross-generational data linkage there?
Yeah, I've actually been looking into this recently for a project that we're considering in the future, and are working on a proposal for funding at the moment. So I had conversations with Idris, who are kind of oversee the linkage processes in Scotland. There's a lot of bodies involved. I know it's a very confusing landscape. And they had confirmed that would be possible, and that would be done through the birth records held within the NHS records. So the mother and child are both included in there. So linkage to the mother would be possible. However, as generally the case with linkage to fathers is a lot more complicated. They may or may not be recorded on that data set. they wouldn't be recorded within the health data set with linkage to the birth record held by National Registry for Scotland. They may be contained within that.
Thanks, Joanna. We have a question here relating to the promise and to what extent they'll be using data linkage to track progress against their objectives. And will there be any changes to the way social work stats are collected as a result of that?
Again, I've not seen this question, Mickey, but I won't try and speak on behalf of the Promise Scotland. So remind me, there are two parts to that question.
The first bit was to what extent will the Promise be using data linkage to track progress against their objectives? And I think the answer to that is the Promise are developing the Promise Progress Framework at the moment, which will have a series of outcome indicators that they're going to monitor progress against. That doesn't involve data linkage. It's using existing data for that. The second part, Craig, which you could maybe answer, is will there be any changes to the way social work stats are collected because of the monitoring progress for the Promise?
So I think for the first part that you mentioned existing data, but existing linked data as well is also relevant there. So for the linked data that we've talked about, would be in terms of the way social work data is collected in relation to the Promise or the it's something that would do the fairly significant amount of user engagement on, I would say. So we've got a fairly standard process for doing that, right? So it's something that would involve, the Promise Scotland, but other users of our data and stakeholders as well, including yourselves. So it's certainly obviously a particularly significant thing for us to be thinking about when we're next doing that.
Thanks, Craig. And I'm just conscious of time as we approach past. But there's a question come in saying, in health, we have challenges in ensuring our health systems are up to date with looked after children status information. So they're dependent on social work IT systems being up to date, and manual cross matching has to be undertaken between health and social work every quarter to make sure those two sides match. I think it's something you referred to, Joanna, about on the education side as well. Are you aware of any positive examples of how this is working across Scotland? So where that's working better? I wonder, is there anybody out there in the audience actually that has anything they could stick in the chat about that?
Yeah, sadly, it would be a no from myself. I'm not aware of any, certainly.
Okay, so I think we're at past there. So some interesting stuff in the chat and the questions to follow up on. But I just want to draw today's session to a close and thank everybody for turning up today. First of all, I hope you found the session useful, and I particularly want to thank our panelists, Sharon, Craig and Joanna, for their contributions today, and also to the comms team at Celsius, who it's been extremely difficult to do these events without their wonderful support. So thanks to them too. So thank you, everybody, and I hope you found the session useful, and we'll see you at the next one, hopefully. Take care.
Thanks, everyone.